Our Chief Health Editor, Dr. Partha Nani, joins us now. Dr. Nani, good afternoon.
Afternoon, Alan. How you doing?
I'm doing good, Doctor. Thank you. So the CDC announced guidance for people who are fully vaccinated. What can you tell us about those guidelines?
I think it's terrific news, Alan. Now, first of all, how do you know if you're fully vaccinated, right? You're talking about folks who are fully vaccinated. The CDC is giving some guidelines. How do you know if you're fully vaccinated? Well, the CDC says you are if you've had 2 doses, right? Both doses of the Pfizer or Moderna vaccine, and 2 weeks have passed since the second dose. Or you've had the single dose Johnson & Johnson vaccine, and 2 weeks have passed following that shot. Now, if you're fully vaccinated with that criteria, what can you do? Well, the CDC guidelines say that fully vaccinated people like me can visit other fully vaccinated people without having to social distance or wear a mask. Again, good news. They can also meet at a single household and not wear a mask or physically distance from other people who are not vaccinated, but only if all those folks are at low risk. And fully vaccinated people also don't have to quarantine or be tested if we are exposed to someone with the virus, as long as we don't develop symptoms. Now, fully vaccinated people like myself have to still wear a mask and social distance when they visit people from multiple households and are not vaccinated. And also, we have to follow the pandemic precautions, wear a mask in public and social distance and wash hands. But still, really good news with this guidance from the CDC.
Yeah, that's great news for sure. So health experts are warning that the next COVID-19 surge could be driven by the variant that was first found in the UK. B.1.1.7 case numbers for the U.S. overall have plateaued. So why the warning?
Yeah, Alan, it's plateaued in the U.S., but certainly not here in Michigan. This is a kind of a local disease, right? Just 1 week ago, I was talking about this, how our numbers were up by 6%. Now we've had a 47%, I repeat, 47% increase in the past 14 days. And that in itself is a huge warning sign to Michiganders. It's not over, right? It's not over. Back to your question, though. Why the warning for all the U.S.? Well, first of all, it's March, and we know what March is. It's St. Patty's Day. It's time to party, and spring break, time to party. Two traditions well known for large gatherings, right, that people are getting together. On top of that, there's a rising number of the UK variant strain B.1.1.7. Now, 4 weeks ago, B.1.1.7 made up 1 to 4% of the total virus cases. Now it's 30 to 40%. So you can see how this can exponentially rise.
So experts have been concerned about the B.1.1.7 variant. Just how dangerous is it?
And so, Alan, the latest research shows that in the U.S., the B.1.1.7 is up to 74% more transmissible, meaning it can infect you 74% more than the original virus. In the U.K., when it was first found, the reproduction rate, the infectivity rate, has been estimated as high as 90%. And hospitalization and death rates spiked not just in the U.K., but all of Europe. Unfortunately, experts who have been tracking the variant say that it's very hard to control. Right now, we're just under 10% fully vaccinated, likely not enough to stop a surge with this new variant. So 2 messages. One is good news. The CDC is giving us some guidance. If you're fully vaccinated, hey, it's getting better, right? But on the other hand, let's not stop what we've been doing. Let's not say it's party time. We've still got a ways to go. Let's get vaccinated. Let's stay protected. And that's how we're going to get past this.
Yeah, again, the most important thing, when your time does come up to get the vaccine, make sure you get that. But until then, be sure to follow those health guidelines. Dr. Nandi, so great to see you. Thank you so much for your time.
My pleasure. Thank you, sir.
Glenda?